So when there is a flexion, if I focus on the elbow, there is a decrease in the angle of the joint. So angle of the joint is decreased. If I say at the level of elbow, if I am doing an extension, there is an increase in the angle of the joint. So if I use a goniometer as an instrument and check the angle of the joint, when the angle is reducing, it is a flexion. When the angle is increasing, it is extension. And I already mentioned the center of gravity. The center of gravity, imaginary line, you can call it as a median line, median. So the movement of the body away from the midline is called as abduction. Abduction, going away from the abduct. When you hear somebody kidnapped or abducted, so it means taking away. So if I am moving my leg, right leg, I will move towards outside, is abduction. I am taking my hands outside, is an abduction. Left hand abducts. If opposite of that, if the joint abduction, this movement is towards the midline, if I am bringing my hand towards the midline, it is called as adduction. So towards the midline is adduction, away from the midline is abduction. ABDUCTION, abduct, abducting, taking away. Adduct, bringing in. So extension, flexion, abduction, adduction. So flexion, extension at the elbow, flexion, extension at the knee. If I make my toes pointing downwards, it is called as dorsiflexion. If I make it upward, it is called as plantar flexion. If I make the palm facing upwards at the level of elbow, it is called as supination. If I turn my palm downwards, it is called as pronation. If I raise my shoulder up, it is called as elevation. If I bring it down, it is called as depression. If I do a complete circular movement, it is called as circumduction or rotation. So like this, there are various range of moments and various moment terminologies we use for describing various parts of the body. If anything towards the head, we call it as a cranial. Cranium means skull. If anything towards the tail, caudal, C-A-U-D-A-L, cranial, caudal. If it is front side of your body, we call it as anterior. If it is the back side of your body, we call it as a posterior. If it is near the midline, we call it as a medial. If it is going away from the midline, we call it as lateral. So these are different planes of the human body. So we have our skeletal system. We divide the skeletal system into axial skeleton and appendicular skeleton. Axial skeleton is the skeletal structure which is there at the central line, medial line. Appendicular means it is attached. So your both limbs, upper extremity and lower extremities are appendicular skeletal, and central, your skull, sternum, your spine, vertebral body, the pelvis, it will come under axial skeleton.